Part 6, optimizing the thyroid. How do we do that from a natural health perspective? Well, let's first talk about what can be a drawback to some of the synthetic or pharmaceutical type of stimulation of the thyroid would be a T4 increase. So you may get a prescription to increase your T4, which remember the T4 is inactive until it's converted in the liver to T3. If your liver is unable to convert through methylation, either genetically or through liver insufficiency, then the T4 doesn't really do you much good. And the body won't produce the T3 that's necessary if it continues to have too high levels of T4. So T4 only is insufficient. If you do a T3 and a T4, then that's a better indicator of how of being able to stimulate the thyroid properly and give your body the hormones it needs. Now we can talk about natural health things or natural health perspective first. We want to support it with proper diet, proper lifestyle, a vitamin E's, an iodine supplement, and maybe Brazil nuts. There are many things that we can do that we want to look at first and see if we can't lower your stress, as we talked about in the last video. There are many things that we can do first before we have to go to the T3, T4 synthetic introduction into the body. So we want to take that, just like the test, we want to look at comprehensively how is the body producing all of the hormones necessary around the thyroid. Is it functioning properly? Is it being protected with the antibodies necessary? And then if those show indications of weakness, then we need to support the thyroid through the natural means necessary. And we do that here at Magnolia Health. We first try to figure out what is happening. We can send out or have you go get your blood drawn and do a thyroid test. And then it goes to a lab and then comes here for analysis. And so that's something that we do here at Magnolia. But we want to first look and see if we can support it naturally, because maybe you aren't feeling a good way or you don't want to, maybe can't afford the test, and we want to see what we can do to balance that in a proper way.